You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, how small improvements to your smile can make a big difference. With us, we have America's orthodontist, Dr. Chavez. Dr. Chavez, welcome to the program.
Thanks, Randy. Great to be here.
Now, before we get into today's topic, because you have one of the busiest practices on the East Coast, and for people that don't know you, tell us a little bit about your practice. And also, I guess you work with your son as well.
Yeah, we are Arch Orthodontics, and Arch came into being when my son, Dr. Chase, joined the practice in 1998. We took his first name A, my first name R, and CH to make Arch Orthodontics.
Okay.
And we've been enjoying our practice together in a way that I never thought could be possible. We really have a great time, and we've developed a practice that is second to none in the Commonwealth of Massachusetts. It's absolutely great.
Good. You know, I was on the telephone, and I told you this when you came in today, with you. And I thought, wow, this is going to be a boring phone call with, respectfully, with an orthodontist. I got off that phone call. You gave me a different level of appreciation for a smile and the importance of a smile. So how important do you think a smile is?
Well, there's a big question about whether we're carrying our brains around with us or whether our brains are carrying us with them. And essentially what I'm saying to you is that when you relate to someone, when you relate to the world, you're actually saying, here I am from the inside. And when everything is good on the outside and you really begin to look at yourself and feel great, that's when the inner smile begins to come out. We create the inner smile.
Is that right?
Yeah.
I mean, you believe that you are changing people's lives, especially the children, setting them up for success. And I don't want to put words in your mouth, but I think these are the kind of things you told me on the telephone.
Well, changing people's lives is a very easy way to say we create the environment for the individuals to change their own lives. We take away the impediment, the blocks, the insecurities, the idea that I'm something not exactly what I want to be, and then I am. So changing people's lives is kind of an easy way to say there's great confidence and happiness with what we do.
I mean, what are the different ways you offer now to straighten teeth?
Well, it's an incredible variety of options that when we first started treating people in the early 70s has expanded exponentially to techniques and devices in terms of diagnosis which create an environment for rapid treatment, effective treatment, and treatment that's relatively invisible. So the changes are more effective, more efficient, and more invisible.
Now with Invisalign, though, there's a lot of general dentists doing Invisalign. Why go to an orthodontist over a general dentist for Invisalign? Because it seems rather routine in a way.
Well,
Respectfully,
when it comes to you, there's nothing routine.
Okay.
You're the most important person in your world. And with the added education that we have, the ability to use so many different techniques, we are far and away superior to a generalist who does so many other types of procedures in the mouth. And there isn't a difference in cost when it comes down to when it's done right. That's where we shine. That's where we do the best possible service to you, to have the right job done in as quickly a period of time as can happen.
So who is your typical patient? I mean, is it the kids? Are you seeing more and more adults? What are the age ranges?
Well, the age ranges are from very young, depending upon the problem that they have, to very old, depending upon your outlook in terms of what you feel is old. Our oldest patient was 84. Our youngest patient was 4. So
is that common? I mean, are the patients getting older and older when it comes to adult orthodontics?
Well, of course, because of the newer techniques that we have, it's opened up an incredible field in terms of age, because it's no longer broadcast that something is being done, something that's been wanting to, an individual wants to have done for so many years of their lives. They could have it now.
What does that mean, it's no longer broadcast?
Well, if I told you that I was wearing aligners right now, would you notice it?
No. Are you?
No. But this is what it looks like. We're not.
Because you could hide the braces behind the teeth? Is that what you're saying?
Well, no, you can hide the braces behind your teeth with lingual braces, but aligners, in a sense, give kind of like a tooth whitening effect to the smile. They're very shiny, very bright, and it smooths out the malocclusion, the bad position of the teeth, almost immediately. So when you start your treatment with aligners, or when you start your treatment with Invisalign, with braces behind the teeth, it's not obvious.
Why would an 84-year-old want to get orthodontics?
Why wouldn't she? What makes a desire to have a change in your body age dependent? The unique thing about this is that it can be done. The wonderful thing is that it can be done without significant discomfort, if at all. The best thing about it is that you can get what you want at any age that you want it.
Is that right?
Yeah,
Okay, good.
you can
good,
get what you
good.
want.
Now, you brought a lot of photos today.
I did. I'd like to show you this one, Randy.
Because you say
This
it
is
can
our
really
thing.
make a difference in the appearance.
Exactly.
And I told you, because to me it's just teeth, but not to you.
Sure.
It's not just teeth to you.
Right.
Right?
Let me let you see
Okay.
this particular patient. She's just absolutely a darling. Laura came to us
girl.
because her brother was in our practice beforehand. And parents were absolutely delighted with the results. And if you take a look at Laura and her smile, you can see that the teeth kind of like tilt toward her right, a little bit left in the photograph, and that they're spaced. And even though she's a delightful pixie-like girl, the teeth are not perfect, and they're not exactly.
Now,
the way
was
they
this her
should be.
parent? Do you remember? Was it her parents' idea, or the little girl's idea?
It was a parent's idea because Mom saw this. Mom recognized that there was something wrong with the way the teeth were coming out of the bone. And she said, Dr. Chavez, would you take a look at Laura for us? And we waited for a long time before we even started the case. And when those teeth didn't straighten up and those spaces didn't close, we decided to go in, take care of the problem, and now she enjoys an incredible smile. And you can see, she is such a winner. She's such
Great
a
smile.
beautiful girl, and she has the greatest, most confident smile that you could ever have.
And what if they do nothing, by the way? I mean, the fact that you got her early, what happens if they wait too long? Like wait until
Well-
their high school years?
Well, it's a little bit more difficult. Sometimes it takes more time, and sometimes our options are reduced in terms of the way we take care of the kids. Just like a bird needs to have a specific time to fly, otherwise they don't fly properly. There's a time when things should happen because it's the best time for it to happen. And we know when that is, and we can tell exactly when to start our treatment so that we can finish our treatment very quickly.
So, for example, her finished treatment, this is before 7th, 8th grade? Or this is,
she's going into the 9th grade this year.
so high school years aren't with braces now? Because the mother got involved.
Oh God, no! She's ready to go in high school with the most confident grin. She's a confident girl. She's gonna do great.
What do you say to parents that are watching this? Because look, I have an 11-year-old, I have a 21-year-old, but you want your kids to have a great self-esteem. So not everybody is going to see the orthodontist right away. Right? She saw him
Randy,
early.
we look at our kids all the time, and we have questions about what should be done. We go to the pediatrician for well baby visits, and there are so many questions in the beginning. And they continue on at every single stage, at every single age, there are questions to ask. As soon as you see the teeth not the way they should be, or if you have a question about that, that's the time to come in. The delightful thing about coming to Arch Orthodontics is that we have a complimentary examination. We love to spend time with you, to educate you, to let you know what it is professionally that's going on and what we can do if something is necessary. Many of the times it's just to watch. And we've enjoyed the situation of watching the kids for 2 and 3 years.
Are you set up for kids?
Absolutely.
We have games or something?
Oh, the office is replete with everything that we could have for kids to be interested in. But most of the time, you don't wait a lot of time in our office. We run on a very good schedule. There's not a lot of waiting at all. When you come in, you're ready to go.
Really?
Yeah.
Okay.
Let me let you take a look at this young fella. Now, here's a situation where the mom saw that there was something going on with the way the teeth were coming in. And you can see from the photograph, it doesn't look like a really bad smile, but that tooth on the left, his left, your right, was kind of like tucked in and behind. Well, it was a crossbite. And a crossbite is very, very devastating as far as the way the development of the teeth will occur. Well, at the right time we went in, and within a year he was finished with his treatment. So as you take a look at this case, you can see that one of the teeth on the top is crossed with the teeth on the bottom. That doesn't allow the jaw to go side to side effectively. And when that trauma happens, when the teeth come together while the child is chewing, it could cause damage to the supporting tissues of the teeth, the periodontium, the bone and the roots around the teeth. That's a significant problem that could cause several things to happen. I'm going to show you another case in a little while that kind of like builds on that and what we can do to correct it. So we corrected the crossbite, and then we went into traditional braces, and he has a fabulous smile. He's a very confident smile. He's a really happy kid now.
Good, good. And the case is completed at an early age.
Case is completed before high school. He is ready to go. He happens to have been at a stage where he developed at a time that it was appropriate for him to be finished, and that's what we have to wait. We have to wait for the kids to grow and finish the development of their dentition before we're finished. And that's where the commencement, the starting of the case is so important for us to get it at the right time, do the work that we have to do, and then get out.
Okay. Do parents wait too long, you think?
I think that parents can wait too long, but nowadays with the information that's available, many people are coming in at the right time, and they're calling our offices to find out.
What about the children? Did the children ever tell you that kids are making fun of their teeth, or that they don't like their smile? Do you hear this?
Randy, it's uncomfortable today with the emphasis on bullying and the emphasis on person-to-person relationships, how some kids are teased in a way that is extremely disturbing. So there are stories that show that buck teeth, Bucky, and all of these names that we remember from when we were youngsters.
I interviewed your son. He said like shark teeth. I mean, a lot of nicknames associated with teeth. So these kids really...
Of course. Where is it? It's on the face. What happens when there's a communication? What do they see? What do they pick on? That you can see, and the smile is the first thing, or one of the first things that you can pick up in terms of a problem area. We take care of that.
Okay, good.
Here's another case I'd like to show you, and this is a case where the child came in having not had treatment at the right time, and you'll notice how the shape of the face is such that the bottom part is shifted over to the side, that the face is not straight.
Interesting. It's like the chin isn't lining up with the nose.
Exactly. The chin is not lining up with the nose, and after treatment, because we were
able
to...
And that's a dental situation?
That's a dental condition. It is an accommodation for the height, the points, and the depths, the valleys of the teeth, and the way they come together. And because you have to close the teeth together, if they don't hit in the right way, the jaw and the mouth will shift to the side in order to get a complete closure. Well, when we're finished with orthodontic treatment, two things happen. Number one, the bite was corrected.
Very nice.
And number two, the face was correct. Randy, take a look at her chin and her nose in the before picture. Mm-hmm. Notice how it's off to the side. Take a look at her chin and the nose in the after picture. Notice how it's on the same line. Notice how her face now has wonderful symmetry. Notice how her smile looks so wonderful.
Good job. That's interesting.
And that's with surgery.
How did they come to you, by the way? Because she had straight teeth.
She did.
So why an orthodontist? I mean, who tipped? What was it? A pediatric? I mean, who told them to go to you?
This was her dentist who said, "My goodness, you need to have something done."
Oh, good.
Go see Arch Orthodontics. That's the place to go to get it corrected.
Okay, good.
Let me show you this case, Randy, if you don't mind, please. Here's a girl who's happy and delightful in the before picture. But when you take a look at her teeth, you can see that there is a significant problem. Another referral from our local dentists who look at Arch Orthodontics in all the towns that we're in as the best place to go for the care that we deliver.
So when she smiles on the before, her teeth aren't showing?
Correct.
Is it because they're like positioned backwards or
It's
inward?
because she just knows it's not the greatest.
Oh, she's
part.
covering it up.
She's holding back. She's holding back in her smile, and this happens so often because kids know what's going on, know what's going on in their lives.
So you spot that, like when you say smile for this photo. I mean, you can
Right.
spot it
It's,
a mile away.
You know,
like they're-
smile for the photo before, smile for the photo after. The same techniques are used in order to get the kids to smile. The difference is where
So
the
she was
inside,
self-conscious.
the inside, that is that inner smile, that inner confidence, that's changed so much when your teeth are straight, when everything is in the right position, and you look great, feel great, and work great. That's what we ask. That's what we tell the kids.
You do?
At the end of
Like, what
treatment,
do you
your
tell
teeth
them?
are going to look great, feel great, work great. But what you have to do to get there is help us clean the teeth, move the teeth, and hold the teeth. You got to clean them, move them, and hold them. And what you get are teeth that look great, feel great, and work great for the rest of your lives.
I mean, this is, and when we look at this after, I mean, this is a very pretty smile here. What a difference.
It's great. She loved it. She loves her smile. She loved the whole process. She's one of our bluebirds. She goes around and says, that Arch Orthodontics, that's a great place to go.
So the little girl
there.
is actually telling her friends, you've got to go to Arch Orthodontist.
Oh,
Are you
know,
kidding me?
We have kids club. We have contests. It's a gas to come to our office.
Because nobody likes going to the dentist, right?
Correct.
Or the orthodontist.
They love
they like going there.
They love going to Arch
Do they
Orthodontics.
really?
They really do. It's great. Let me tell you someone
Okay.
else who loves going to Arch Orthodontics.
Okay.
Our adults. Let's take a look at Diane. Diane is a teacher. She's a Brownie leader and a public speaker for her church. She had a significant problem, and her teeth were very, very protrusive. Take a look at those teeth, Randy. Take a look at how far forward they are. Take a look at the profile view and the way her lips are jutting forward.
Okay.
So when you take a look at the beginning and you take a look at the after,
Wow.
you'll notice how straight her teeth look now. Notice how the profile is changed. Before, her lips were in front of her nose and chin. Now,
Interesting.
at the end of treatment, her lips are where they belong, behind the nose and slightly in front of the chin. They look fabulous.
What does she
That's
say when it's all
magic.
done?
What does
I
she
mean-
say?
I mean,
What does she do? She throws her arms around you. She says, "Thank you so much. Thank you so much." And we have so many stories about the way her life has changed. She's another one of our bluebirds.
Okay. A bluebird to you is what? They go out.
Someone who says, "This is the place to go. This is where I've had a wonderful service. This is what you have to do in order to get what you want." Randy, here's another patient I'd like to take a look at quickly. This is another one
Whoa.
where there was a severe anterior cross bite, meaning that the front teeth were behind each other in terms of the top being behind the bottom.
Like an underbite.
Right, an underbite, instead of the other way around. Well, with our orthodontic techniques, we were able to change that, and now when you take a look at her smile, you can see how big and broad and excited she is about having and being able to show off this particular type of charm. We've developed
Charm?
a charm. She has a charm now. Where she didn't have a charm, she has a charm now.
Smile
and
can
whenever,
give you a charm.
Exactly. Whenever she wants to light up her charm, all she has to do is feel it and let you see it. It's great. It's absolutely great.
Okay. Because, you know, yeah, I mean, one of the things you point out, very, very good point. You say that most of our communication is nonverbal. Elaborate on that.
Well, the nonverbal communications are said to be about 90% of the communication. The rest of it, the tilt of the head, the widening of the eyes, the slight little movement of the head, the movement of the lips. These are interactions that occur between people that say much more than what's coming out of the mouth. You're hearing it, but more importantly, when you see all these communications, the way the hands are sitting, the way the shoulders, and the way the posture, they tell you so much more than just the spoken word. So it's that nonverbal communication, that ability to kind of like be and lean into who it is that you want to speak with, to be able to stand back and say, well, I'm not so sure. These are the type of these are the nonverbal communications that mean so much in an interaction between
So when you
people.
get people smiling again,
yeah,
everything changes.
everything changes, because they know they have a charm, they know they have an instrument, they know they have what it takes in order for them to feel as perfect as they need to be in order to convey the meanings. That's the brain talking. We're walking around in something that allows for communication, and it happens from the area between the nose and the chin, but that's not the only place it's located.
Okay. Now we're talking about, for people just tuning in, we're talking about adult orthodontics right now. Change your smile. You can change your life. What else do you have?
Well, I have another patient who came to us because there was something subtle.
Yeah, it looks like a
something
good
small,
smile. I don't see it.
Something not exactly the way she wanted. Take a look at her upper left tooth. Notice how it's slightly turned and rotated? She didn't like that. And so within 6 months' time, we were able to correct that particular problem, and she's absolutely delighted. Beautiful woman, saw something wrong, wanted it changed, and look at the difference in the confidence of her smile before and after. Notice how she's portraying herself in a more engaging way.
So there's a lot of people with just one little issue, one tooth that's moved forward or shifted or tilted.
You can
that
have
bugs them.
anything that you want, and if it's a little thing, we can take care of it. If it's a big thing, we can take care
Is
of
that
it.
Invisalign in this particular case?
In this particular case, we did use Invisalign.
You know, one of the I can mention this. One of the people that works here at the studio, we take photos and we post them on our business Facebook page with the doctors. Tracy, who handles our airtime, she had this. Reminded me, she has a shifted tooth. I've never noticed it, never saw it until she pointed it out. She doesn't like it at all. She hates it, I think.
Well,
She's getting it taken care of, by the way, with Invisalign.
I tell you, we are
Starts Monday.
Yeah, right.
She does, really.
We're actually our own worst enemy. We really do look good, and when we focus on looking at ourselves in the mirrors that we have, sometimes we come up short to ourselves, not visible as far as the outside world is concerned, but you need that inside for yourself. You want to be able to say, I have control over my life, and certainly control over my body. How many people go and exercise? How many people watch what they eat? How many people are engaged in taking care of themselves in a way that they hadn't before? How many have resolutions to do something? Well, we're a resolution that gets resolved. We're a place where if you have a question, if you have a desire, we can take care of that. And we take care of it in a way that really honors what it is that we want to do and what it is that you want to do. Care, concern, and compassion.
So if you don't
That's
like your
our
smile,
watchword.
do something about it. Do you believe it holds you back in
Well,
life?
I believe
that
it
means if
can.
you hate your smile, do you think it
I
holds you
believe
back?
it can hold you back. It doesn't necessarily hold you back. I mean, then whatever decisions you make, that's really where life is coming from. But if that's one of the things that you think about before you step forward, take care of it and take the step.
Okay. Okay. And we're just about out of time, but I know you have a lot of photos, so we'll get through these.
Let me show you this, please, Randy. This is a young girl who, when you take a look at the first picture, you can see how kind of attentive her smile is. You can see how the teeth are protruded and spaced in a way that kind of like doesn't honor the way the rest of her face and the rest of her smile is. And when you take a look at the finished product, when you take a look at the way the teeth look
Very
after
nice.
she's done, that's a confident smile. That's an excited smile. That's a smile that really means something, because now in sophomore grade, she can go forward in her cheerleading, she can go forward in her clubs, she goes forward in her sports, and she really enjoys what we've done and is so appreciative of having the opportunity to be at Arch Orthodontics.
Okay, good.
One more case before we go, and this is another young fella who has a protrusion of the teeth. This is one of the most frequent types of problems that we solve. About 60% of
like
our
an
cases.
overbite?
Exactly. About 60% of our cases are overbites, protrusions, rotations of teeth, and incorrect connections between the teeth. Incorrect interdigitations. Come back on that.
Okay.
All right. This is one of the things that we take care of most frequently. It's a protrusion, an overbite, and when we're done, we have a fabulous, healthy bite that can be enjoyed for the rest
Will you have
of the day.
financing available?
Absolutely. Cost has never been a problem as far as getting treatment in our office.
Because everybody's busy. I mean, the kids are busy. They're on the computer, right? They're at school. The parents are also now on the computer.
And why not? That's exactly what is occurring.
So things like this
in
may
life.
get neglected. So if you see your child, get an evaluation. Especially if you see an obvious one, get them evaluated. Like an obvious overbite, crooked teeth.
Anytime you notice it as a parent, anytime a child notices it as a child in their own self. Hey, mommy, how come my teeth are sticking forward like this? Hey, mommy, how come this tooth is turned? Why do I have a space here? These are the questions that can be answered in our offices, and it can be answered in a way that gives you the information before you make a decision to go ahead and correct it.
And we are out of time. But final message to somebody, an adult, they don't like their smile. A parent that sees problems with their kid's teeth, but for whatever reason they're both putting it off. What do you say? What do you say to them?
To those who are procrastinating, procrastinate no more. This is the place to go for an unhurried, complete information gathering opportunity to deal with this problem in a way that honors your pocketbook, in a way that honors your perspective, in a way that honors what you want for your children and for yourself.
Okay, good. Thank you so much for coming on the program.
Randy, thank you.
Very
Appreciate
interesting.
your time.
You and your son, by the way.
Thank you.
Love this interview today, and very inspirational. So, and these photos are all on your website.
Sure.
They can look at them.
Absolutely.
Things like that. Thanks again. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, you could visit our website and just plug in orthodontist or orthodontics or Dr. Chavez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.